Welcome to our channel.
Alzheimer's, triple activity diabetes tranquilize indicates guarantee as treatment. Alzheimer's is a cerebrum squandering sickness that records for 50–75% of instances of dementia, which is a condition wherein individuals bit by bit lose their capacity to think, recollect, decide, hold a discussion, and take care of themselves. As the ailment advances, the mind experiences organic and concoction changes, and specific regions recoil as nerve cells, or neurons, bite the dust. The correct reasons for Alzheimer's are as of now obscure, yet infinitesimal examinations of influenced cerebrum tissue have uncovered two trademarks: anomalous gatherings of protein portions known as plaques and tangles. Current medicines have no genuine effect. The quantity of individuals with Alzheimer's ailment is rising quickly as the populace ages. In 2015, there were an expected 46.8 million individuals overall living with dementia, and this number is required to achieve more than 130 million of every 2050. In the United States, where Alzheimer's is at present the sixth driving reason for death, there are an expected 5 million individuals living with Alzheimer's malady. This is relied upon to ascend to 16 million by 2050, joined by a critical ascent in costs. To the U.S., the cost of Alzheimer's and different reasons for dementia in 2017 was evaluated to be $259 billion and is required to ascend to $1.1 trillion by 2050. At display, there is no cure for Alzheimer's infection, and there are likewise no medications that have a critical effect to the indications. Medication raises movement of 3 development factors. Sort 2 diabetes is a sickness that outcomes from insulin protection, a condition in which cells turn out to be less touchy to insulin and in this way less ready to take in glucose from the circulatory system to use as vitality. The pancreas makes more insulin to adjust, yet in the long run it will be not able to keep up and blood glucose levels will rise, prompting prediabetes, diabetes, and other medical issues. Past investigations have uncovered that compose 2 diabetes is a hazard factor for Alzheimer's, and issues with development factor flagging have been distinguished in the brains of individuals with the sickness. The new investigation is the first to demonstrate that a triple receptor agonist may shield the mind from the dynamic cerebrum harm that happens in Alzheimer's ailment. Steady neuroprotective impacts. The analysts tried the medication on mature DAP-PS1 mice whose brains were in the propelled phases of degeneration. Application PS1 mice are built transgenic mice that convey variants of human qualities that are connected to an acquired type of Alzheimer's. In a labyrinth learning test, the treated mice demonstrated enhanced memory development. Likewise, examination of their mind tissue demonstrated a lessening in amyloid plaques, irritation, and oxidative pressure. Treated mice demonstrated high rates of new nerve cell age and cell-to-cell associations, and expanded levels of a development factor called mind-determined neurotrophic factor, which ensures nerve cells. These extremely encouraging results, says Professor Holscher, exhibit the adequacy of these novel numerous receptor tranquilizers that initially were produced to treat compose 2 diabetes yet have indicated steady neuroprotective impacts in a few investigations. He takes note of that clinical investigations that utilized the more established variant of a similar sort of medication have just demonstrated exceptionally encouraging outcomes in individuals with Alzheimer's ailment or with disposition issue. The scientists trust that their discoveries point to a promising bearing in which to search for new medicines for Alzheimer's infection. Thank you for watching our video. Do not forget to subscribe to see our next video.